Dr. Hancock, Dr. Ridgway, thank you so much for joining me today.
Thank you. It's great to be here.
Great to be here. Thank you.
Dr. Hancock, you're responsible for one of the 4 major pillars underpinning Cleveland Clinic as Chief Caregiver Officer. What do you think the creation of such a role says about this organization's priorities?
Well, to begin with, Cleveland Clinic's guiding principle is to treat our patients and our fellow caregivers as family and our organization as our home. So the creation of the Chief Caregiver Officer, I think, really speaks to our organization's commitment to our caregivers, to really look at all aspects of their professional development while in our organization. And it really provides us an opportunity to look at all those aspects while thinking about the culture we want to create.
Caregiving can also be relentless in terms of timetables and working hours, particularly, I'm sure, during a pandemic. Dr. Hancock, how have managers in different parts of the business and different geographies sought to encourage their respective teams to take downtime when they need it? And have you seen that positively impact metrics like staff turnover and retention, for example?
Sure, so definitely, our leaders have been incredible during this pandemic, particularly our frontline leaders, caregivers as individuals, again, to really have what really excites you about what you do every day. What else can we do to support you, particularly during this pandemic? And then also they bring together the teams. Again, so there's an opportunity of dialogue so they can share with one another how they can better support each other and be a better teammate while at work.
Well, let's talk about career paths there. You just mentioned it. And let me turn to you, Dr. Ridgway. How have you sought to develop your employees in terms of their career paths? And how have you found that effort has been working when it comes to their fulfillment?
Yes, our employees are caregivers, and everyone who works here is considered a caregiver. They are our greatest asset by far, and it's really what makes this organization work. Our vision is to be the best place for care anywhere and the best place to work in healthcare. And we recognize that there are many paths to success in our organization, and we honor that uniqueness. We have an entire institute at Cleveland Clinic dedicated to learning and leadership improvement. We also provide tuition and reimbursement for courses outside of our organization and have robust coaching and mentoring programs here at Cleveland Clinic. Ultimately, we measure how we're doing every single year and really take evidence into how we're doing, what can we do better, how can we support our caregivers, and how can we provide that feedback to our leaders.
Well, Dr. Ridgway, Dr. Hancock, that's clearly incredibly important work you're doing. And thanks for taking time out of your schedules to tell us more about it today.